So now we are going to look at some details regarding the fourth ventricle, some of the relations and structures in the fourth ventricle. You see, when we take a sagittal section of the brain and look at the medial view, we already have seen that the fourth ventricle is going to be sandwiched between two structures. There is cerebellum posteriorly as the roof and brainstem anteriorly as the floor. Let us magnify the diagram. You find that when we are talking about the fourth ventricle, what is going to be the floor is in fact the pons, and along with the pons you will also find, see, this is the pons, and along with pons you will also find upper half of the medulla oblongata. It is dorsal view of the pons and also dorsal view of the upper half of medulla oblongata. Let us do one thing. We will now remove the cerebellum from the posterior view and look at the floor of the fourth ventricle from the posterior view. After removing cerebellum by cutting the peduncles, we are going to look at the floor of the fourth ventricle from the posterior view, so that you can look at dorsal view of the pons and dorsal view of the medulla oblongata. Let's do that. And as you see, this is the posterior view. What you find is that when we remove this cerebellum from the posterior aspect of the brainstem, that is the time when you can see the floor of the fourth ventricle. But to look at the floor of the fourth ventricle, we must have cut the peduncles, superior, middle and inferior cerebellar peduncles. So we want to actually focus here. That is our topic of discussion. See, when we are looking at the floor of the fourth ventricle, it is not possible until we have cut the peduncles to remove the cerebellum from the posterior side, which we already have done. What we want to do is, we want to look at the structures now which are there at the floor. So what you find is there is a rounded elevation which is called as facial colliculus at the floor of the fourth ventricle. It is produced by axons of the facial nerve, though deep to that is abducent nucleus, but abducent nucleus is not producing the elevation. Understand? Superior colliculus, which is the rounded elevation seen in the floor of the fourth ventricle, is produced by axons of the facial nerve. Maybe deep to that is abducent nucleus, but that nucleus do not produce the elevation. What is the point? Point is, one question came, there was a explanation given. Facial colliculus is damaged. Which muscle is compromised? Is it the risorius supplied by facial nerve, or is it the lateral rectus supplied by abducent nerve? What is the question? Question is, injury to facial colliculus, which muscle compromised? Risorius or lateral rectus? Actually both. Both are compromised. But if you want to have one answer, then first answer is risorius and second answer is lateral rectus. Why so? Because this colliculus is basically due to facial nerve. So first muscle compromise, the risorius, and deep to that is abducent nucleus damage. So second to compromise is lateral rectus. I'll discuss about this later as well. At this moment, you are looking at some lines, striations, and these striations are moving towards the medulla, and we are calling them as stria medullaris. So there are some striations at the floor of the fourth ventricle going towards the medulla called stria medullaris, and then you are looking at the hypoglossal trigone. The most medial nucleus is the hypoglossal nucleus, and due to that nucleus there is some elevation called hypoglossal trigone. Lateral to that is the 10th nucleus, producing a vagal trigone, and if you go still more lateral, there will be vestibular nuclei, and that is the vestibular area. Eighth nerve is most lateral. See, what we are looking at is the floor of the fourth ventricle, and it is the dorsal side of the upper half of medulla oblongata. This is the upper half of medulla oblongata seen from the dorsal side. When you say this is the medulla oblongata upper half, what is in the lower half? Lower half is actually having central canal. the fourth ventricle is only in the upper half. So floor of the fourth ventricle, which nuclei is the most medial? That is the 12th nucleus. And what is lateral to that? 10th nucleus. And what is the most lateral? That is the vestibular. You have to understand that if there is a lateral medullary syndrome, then the vestibular nucleus will be involved, and if there is a medial medullary syndrome, then the hypoglossal nucleus will be involved. So medial medullary syndrome will involve the hypoglossal nucleus because it is near the midline, and vestibular nucleus will be involved in lateral medullary syndrome like Wallenberg syndrome present with vertigo. Why? Because vestibular nucleus is more lateral. Now, Wallenberg syndrome, lateral medullary syndrome present with vertigo due to injury of vestibular nucleus. What about the medial medullary syndrome? Tongue muscle palsy. Why tongue muscle palsy? Because medially placed nucleus is hypoglossal nucleus. We'll draw a diagram and discuss again. But at this moment, let us look at the nucleus ceruleus. As you are talking about the nucleus ceruleus, it is present at the floor of the fourth ventricle, is dark color. Why it is dark color? Due to deposition of melanin. And where do you see that? It is the dorsum of the pons. Which pons? Upper pons or lower pons? Actually, upper pons. Remember, the nucleus ceruleus is present at the floor of the fourth ventricle on the dorsum of upper pons. What was the facial colliculus present at? Dorsum of the lower pons. So, facial colliculus is on the dorsum of lower pons, whereas the nucleus ceruleus is at the dorsum of the upper pons. But everything is floor of the fourth ventricle. Now, once you have that orientation, let's draw the diagram. First, you start with a midline of the body and then tell this is the floor of the fourth ventricle, which is actually a diamond-shaped ventricle, rhomboid-shaped ventricle. And then you found that there are some stria medullaris. And when you are talking about the stria medullaris or some striation, some lines going towards the medulla, that is where you have the pontomedullary junction also. You mean to say this is the medulla oblongata, which is inferior, and above is pons superior? Yes, because pons are superior, medulla oblongata inferior. This is pontomedullary junction, and this is where you have stria medullaris. At the pontomedullary junction, if you remember, we have discussed earlier that there will be the vestibular cochlear nerve coming out. In fact, this is the vestibulocochlear nuclei area. Now, when you say this is vestibular cochlear nuclei area, there we have discussed vestibular cochlear nerve coming at the pontomedullary junction, and also this is the vestibular area. So, if this is the vestibular area, we have mentioned it will be involved in lateral medullary ischemia, Wallenberg syndrome. The patient is presenting with vertigo. And what about the medial medullary syndrome? Actually, you are looking at the floor of the fourth ventricle, and this is upper half of the medulla oblongata. Now, when you say this is the upper half of the medulla oblongata, that is where you are talking about the 12th nucleus, which is near the midline. Now, if you say 12th nucleus is near the midline, the hypoglossal trigone is near the midline. What was laterally present? That was the 10th nucleus. So, what was the name? That was the vagal trigone. Vagal trigone. So, as you are looking at the floor of the fourth ventricle, which is also the dorsal view of the upper half of the medulla oblongata, you will find most medial nucleus, 12th nucleus, this is the 12th trigone. More lateral is 10th nucleus, 10th trigone, and still more lateral was the vestibular area. Vestibular area involved in Wallenberg syndrome leading to vertigo. What about the medial medullary syndrome? In medial medullary syndrome, the structure involved is 12th nerve leading to tongue muscle palsy. Medial medullary syndrome, tongue muscle palsy. To have some orientation only, later we'll discuss more details. Now, Where do you see the facial colliculus? Actually, the facial colliculus is present on the pons. Where on the pons? The lower pons. Where on the lower pons? Dorsal side, of course. So, where is facial colliculus present? Floor of the fourth ventricle, which is also the lower pons on the dorsal side. What is deep to the facial colliculus? Deep to facial colliculus is the abducent nucleus. But remember, it is not the abducent nucleus which is producing this elevation. Remember, the abducent nucleus may be deep to the facial colliculus, but it is not responsible for the facial colliculus. Facial colliculus is produced by the axons of the facial nerve. So, the point was, when there is injury to facial colliculus, the first muscle paralyzed must be axons of facial nerve razorius, and the second muscle paralyzed will be the lateral rectus controlled by abducent nucleus. What else did you see at the floor of fourth ventricle? It was actually the locus ceruleus. Now, when you are talking about the locus ceruleus or you are talking about the nucleus ceruleus, it is dark color. Why it is dark color? It is dark color because of deposition of some melanin there. So, locus ceruleus is seen at the floor of the fourth ventricle, where? On the dorsal side of the pons, the upper pons. So, this is dorsal side of the pons, but the upper pons, because in the lower pons we have seen the facial colliculus. So, these are some of the structure which the examiner is asking at the floor of the fourth ventricle. You have to remember that. One question came, it was asking, all seen at the floor of the fourth ventricle and what is not, and what do you think is the answer? Yes, actually it is not stria terminalis, it was stria medullaris. So that is your answer. Stria terminalis, no, it is stria medullaris. Can you do one thing now? Can you arrange the structure medial to lateral? Which is the most medial? The most medial is hypoglossal triangle, compromise in medial medullary syndrome. What is lateral to that? That was the vagal triangle. And what is most lateral? Most lateral was vestibular area involved in Wallenberg syndrome leading to vertigo. So obviously these triangles or areas are at the floor of fourth ventricle, medial to lateral. 12, 10, 8, 8, 10, 12, like that. Now, as we look at the diagram, same diagram again, you see this is the third ventricle, which is a midline ventricle. Do you remember it was filled with CSF? What is the posterior boundary of the third ventricle in the midline? Pineal gland. And not only pineal gland, but the posterior commissure was also there. What is evident here is only pineal gland. So pineal gland is the posterior boundary of the third ventricle, which is in the midline and filled with CSF. What is here? The two superior colliculi, two inferior colliculi, corpora quadriga minor on the tectum part of the midbrain, dorsal side of the midbrain. So this is the dorsal side of midbrain, tectum part of the midbrain. You have to understand that trochlear nerve is the only cranial nerve which has a dorsal exit from the brain. Otherwise, all cranial nerve come ventral, ventral, ventral. The only cranial nerve which goes dorsal is the trochlear nerve. It will come from the midbrain, the nucleus at the level of inferior colliculus, and the only cranial nerve to exit dorsal. So these are some additional details along with the fourth ventricle we wanted to know. You see, when you're looking at the fourth ventricle, we have seen some details, but along with that we have also seen some details like two superior colliculi and two inferior colliculi and making the corpora quadriga minor. Let me magnify the diagram. These are two superior colliculi and these are two inferior colliculi making corpora quadriga minor. This is the tectum part of the midbrain, and that was the floor of the fourth ventricle. You will see that most medial is 12th and lateral to that will be 10th, and if still more lateral, then it will be the 8th nerve nucleus.